Hello, my dear friends. I'm Dr. Linda Parker, and if you're over 50, I want you to stop whatever you're doing and listen to me carefully for the next few minutes. Every single day, I see people just like you walk into my office with the same look on their face, tired, worried, and frustrated. They tell me, "Doctor, my knees ache every morning," or "My back hurts so much I can't even stand up straight anymore." Some can no longer enjoy their daily walk, and others struggle just to bend down to tie their shoes. The truth is, joint and bone pain doesn't just affect your body. It quietly steals little moments of your life. The morning stroll you loved becomes a painful challenge. Playing with your grandchildren starts to hurt. Climbing the stairs feels like climbing a mountain. And the worst part, many people are told, "Well, that's just part of getting old." I'm here today to tell you something different. That is not the whole truth. Yes, our bodies change with age, but pain is not something you have to accept as your new normal. There are natural ways to help your bones and joints stay stronger, more flexible, and less inflamed, even after the age of 50. You have more control over your health than you may realize. Today, I'm going to share with you one of the simplest, most powerful natural remedies I've used for years with my patients. It doesn't require expensive creams, complicated treatments, or harmful painkillers. In fact, it uses just two ingredients that you probably already have in your kitchen. What makes this remedy special isn't just how easy it is to make, it's how effective it can be when used consistently. It targets inflammation, improves circulation, and helps relieve joint stiffness. I've seen people who thought their pain was forever regain their ability to walk, bend, and move more comfortably again. This remedy is completely natural and gentle on the body, making it ideal for older adults who want to avoid side effects from strong medications. Whether you're dealing with knee pain, back pain, or even stiffness in your hands or shoulders, this can become a part of your nightly routine, a simple step that helps your body heal while you sleep. So, I encourage you to stay with me until the very end of this video. I'll walk you through every step, what ingredients you need, how to prepare the balm correctly, how to apply it the right way, and the best tips to get faster, more lasting relief. Pain doesn't have to control your days, and you are never too old to start feeling better. By the end of this video, you'll have a safe, natural, and proven tool to support your joints, reduce inflammation, and regain some of the comfort and freedom you may have lost. Let's take this step together because your health matters and you deserve to move without pain. I want to share with you a real story. It's about Robert, a 67-year-old retired school teacher who came to my clinic a little over a year ago. He was a kind man, soft-spoken, with a warm smile that was slowly fading because of the pain he was living with every single day. Robert loved walking with his wife every evening. It was their little ritual, a quiet walk through the park, hand in hand. But as the pain in his knees and lower back grew worse, those evening walks became shorter, and eventually they stopped altogether. When he first sat in my office, he told me, "Doctor, I feel like my legs have betrayed me. I can't even walk 2 blocks without sharp pain shooting through my knees. I don't sleep well anymore. I feel old." That last sentence struck me, not because of his age, but because pain was making him feel older than he was. And this is something I see so often with my patients over 50. Pain doesn't just limit the body, it affects the heart, the mood, and even hope. Robert had already tried what most people try, painkillers that helped for a few hours, creams from the pharmacy that gave mild relief, and hot compresses that worked temporarily. But nothing lasted. He didn't want to depend on pills for the rest of his life. That's when I introduced him to a simple, natural remedy I've recommended to many of my patients over the years, a homemade garlic and olive oil balm. I explained to him that this balm wasn't a miracle cure, but a natural support, something that works best when used consistently. I gave him exact instructions on how to prepare it and how to apply it every night before bed. He was a little skeptical at first, but he decided to give it a try. 2 weeks later, Robert returned to my clinic, and this time his smile was back. He told me, "Doctor, I walked with my wife again last night. Not far, but far enough to feel alive again." His pain hadn't disappeared completely, of course, but it had eased enough to give him back a piece of his life. He was sleeping better, moving more, and most importantly, he felt hopeful again. Robert's story isn't unique. I've seen this happen over and over with people in their 50s, 60s, and even 80s. When pain controls your life, it takes away your joy. But when you support your body with natural remedies, gentle movement, and a little consistency, the body has an incredible ability to heal and adapt. So if you're sitting there thinking, "My pain is too much," or "It's too late for me," I want you to remember Robert. He thought the same thing until he gave this remedy a chance. And that small step brought real change. Before we get into how to make this balm, let's start with something simple. The ingredients. The beauty of this remedy is that it doesn't require anything fancy, expensive, or difficult to find. In fact, many of you probably have what you need right now in your own kitchen. For this natural joint and bone balm, you will need just 2 ingredients, both powerful, both natural, and both trusted for generations. The first ingredient is garlic. We'll use 1 medium head of garlic, which usually weighs around 50 grams. If your garlic is a bit larger or smaller, that's perfectly fine. The most important thing is that it's fresh and firm, not old or dried out. Fresh garlic contains the highest amount of its active healing compound called allicin. The second ingredient is olive oil, and not just any olive oil. You want to choose extra virgin cold-pressed olive oil, the highest quality you can find. This is important because cheap, heavily processed oils lose most of their beneficial properties. Extra virgin cold-pressed oil is rich in healthy fats, antioxidants, and anti-inflammatory compounds that work together with garlic to soothe the joints and improve circulation. We'll use about 100 milliliters. That's roughly 2 parts oil to 1 part garlic. Now let's talk for a moment about why these ingredients were chosen. Garlic is not only a kitchen staple, it has been used as natural medicine for centuries. Ancient cultures knew that garlic supported the immune system, improved blood flow, and reduced swelling. Modern science has confirmed these benefits, especially for inflammation, which is one of the biggest causes of joint pain in older adults. As we age, the cartilage in our joints becomes thinner. The synovial fluid that cushions the joints decreases, and inflammation can build up, causing stiffness and pain. Garlic's active compound, allicin, is a natural anti-inflammatory. It helps calm down those inflamed tissues, reduces pain, and supports better movement. It's also antibacterial and supports the immune system, which is important because a healthy body fights inflammation more effectively. Olive oil adds another layer of healing. It contains oleocanthal, a compound that works in a way very similar to common painkillers, but naturally. It helps reduce inflammation gently, without damaging the stomach or kidneys, which is something I always remind my older patients to be careful about. Many seniors use pain medications daily, but they can have side effects over time. Natural remedies like this balm offer a gentle alternative to support the body without harsh chemicals. Together, these 2 ingredients create a simple but powerful blend. Garlic brings the heat, stimulating circulation, fighting inflammation, and helping the joints recover. Olive oil brings the comfort, nourishing the tissues, protecting the joints, and helping the garlic's active compounds absorb into the skin more effectively. And that's all you need to make this balm. 1 medium head of fresh garlic, about 50 grams, 100 milliliters of extra virgin cold-pressed olive oil. Simple ingredients, but when used the right way, they can make a powerful difference. In the next part, I'll explain why these ingredients work so well together inside the body, and why this remedy is especially helpful for people over 50. Before I show you how to prepare this balm, I want to take a few minutes to explain why it actually works. Because when you understand how something helps your body, you're more likely to use it with confidence and consistency. This is something I always tell my patients: knowledge is power. And when it comes to your health, it's never too late to learn. Let's start with garlic, the star of this remedy. Garlic contains a very special natural compound called allicin. Allicin is produced when garlic is crushed or chopped. That's why we never just throw whole garlic into a mixture. We press or finely chop it to activate its healing power. This compound has been shown to have strong anti-inflammatory, antibacterial, and antioxidant effects. Why does this matter for your bones and joints? Because in most people over 50, inflammation is one of the biggest reasons behind joint pain and stiffness. Inflammation can build up slowly over the years due to aging, wear and tear, lack of movement, or even past injuries. This inflammation irritates the tissues around the joint, making movement painful and sometimes even limiting mobility. Allicin helps to calm that inflammation down, allowing your body to heal and function more comfortably. Garlic also improves blood circulation, which is crucial for joint health. When blood flow improves, more oxygen and nutrients reach the affected area, and waste products from inflammation are cleared out more efficiently. Think of it like opening a blocked road so that help can finally arrive where it's needed. Better circulation means the joint receives more support, and this can ease pain naturally over time. Now let's talk about olive oil, the second key ingredient. Olive oil contains compounds like oleocanthal, which works in a way that's surprisingly similar to some pain relief medications, but without the harsh side effects. Oleocanthal gently blocks pain pathways and reduces inflammation in a natural, safe way. It also contains powerful antioxidants that help protect the tissues from further damage. For older adults, this is especially important. Over the years, the protective cartilage in our joints gets thinner. The fluid that cushions the bones can decrease. Muscles and ligaments may not support the joints the way they used to. This makes the joints more sensitive, less flexible, and more prone to inflammation. By applying this garlic and olive oil balm regularly, you're giving your joints natural support from the outside in. Another thing to note is how these two ingredients work together. Garlic brings the active healing compounds. Olive oil acts as a carrier, helping those compounds penetrate deeper into the tissues and at the same time moisturizing and protecting the skin and surrounding areas. It's a simple formula, but when used consistently, it can make a very real difference. Many of my patients over 50 tell me that after using this balm for a few weeks, they notice less stiffness in the morning, more flexibility, and a gentle reduction in daily pain. It doesn't replace your medical treatment, but it's a safe and effective natural partner to help your body heal and move better. So now that you understand why it works, let's move on to the next step. How to actually prepare this balm correctly, step by step, right at home. Let me tell you about Robert. He's a warm, funny 71-year-old retired history teacher who loves gardening and taking his dog Max for evening walks. He's always been the kind of man who listens carefully to his doctor, follows every piece of medical advice, and never misses an appointment. A few months ago, during a routine visit, his doctor recommended a scan to check everything, even though Robert felt fine. The doctor explained it as a standard precaution at his age. Trusting the recommendation, Robert didn't question it. After all, it was supposed to be just another harmless test. The results came back with something unexpected, a tiny shadow on one of his organs. The doctor told him not to panic, but also said more tests were needed immediately. Suddenly, Robert's calm, predictable life was turned upside down. What began as a routine check spiraled into a series of appointments, specialist visits, and procedures. Each new test led to more anxiety, waiting rooms, and sleepless nights filled with what-if thoughts. He imagined the worst: cancer, surgery, a shortened future. After weeks of emotional turmoil, multiple scans, and a biopsy, Robert finally received the verdict. The shadow was nothing dangerous, just a harmless age-related change. He didn't need treatment. He didn't even need follow-up for it. But by then, he had already spent hundreds of dollars, endured weeks of anxiety, and experienced painful procedures that left him bruised and shaken. He told his daughter that the scariest part wasn't the tests themselves, it was the silence while waiting, the fear of the unknown, and the way it made him feel fragile for the first time. Robert's case isn't unique. Many older adults face similar situations where a test finds something that looks suspicious but turns out to be harmless. These incidental findings often lead to more testing, more stress, and sometimes unnecessary treatments. It's called overdiagnosis, and it can be emotionally, physically, and financially draining. Robert learned an important lesson. Not every medical test brings peace of mind. Sometimes it brings unnecessary fear. Now, before agreeing to any new test, he asked clear questions. What happens if the test finds something? Will it change my treatment? Is it truly necessary? That shift gave him back a sense of control over his health. This story isn't meant to scare you. It's meant to remind you that your voice matters. You have the right to ask questions, to understand the purpose of every test, and to make informed choices. For Robert, that experience was a wake-up call. He's healthier now, not because of the scan, but because he's more empowered and less passive when it comes to his care. And that's something every senior deserves, not fear, but clarity, dignity, and confidence in their healthcare journey. So, what can we learn from stories like Robert's and from what many experts have been saying for years? The first big takeaway is this: more testing does not always mean better health. In fact, in many cases for older adults, especially those over 70, routine or unnecessary tests can lead to more harm than good. This might sound surprising because for most of our lives, we've been told that early detection saves lives. And yes, in some situations, it absolutely does. But when tests are done without a clear purpose, they can open doors to overdiagnosis, overtreatment, unnecessary stress, and even medical complications that could have been avoided altogether. Doctors and geriatric specialists often emphasize something crucial. Medical care should be personalized, not automatic. As we age, the goal of healthcare shifts. It's no longer just about finding and fighting every little irregularity in the body. It's about focusing on what truly improves your quality of life, your comfort, and your independence. If a test doesn't help you feel better, live longer, or change how your condition is treated in a meaningful way, then it may not be worth doing in the first place. Many medical guidelines now actually recommend fewer screenings for certain conditions after a certain age. That's not because doctors care less, it's because research shows that after a point, the risks outweigh the benefits. For example, detecting something tiny and slow-growing might sound helpful, but in reality, it may never cause symptoms or harm. Yet, discovering it can set off a chain reaction: more tests, surgeries, medications, and emotional distress. The second takeaway is you have the right to question every test. A good doctor should be willing to explain why a test is needed, how it will affect your treatment, and what could happen if you don't do it. If the answers are vague or don't make sense, it's okay to ask again or even seek a second opinion. Empowerment in healthcare is not about being difficult. It's about being informed and protecting yourself from unnecessary harm. And finally, experts remind us that your health is about the bigger picture. It's about your daily comfort, your ability to enjoy life, and your peace of mind. That sometimes means choosing not to chase every minor medical abnormality, especially if it won't change anything meaningful. It's a shift from fight everything to focus on what matters. Robert's story shows the emotional toll of unnecessary testing, but it also shows something even more powerful, the strength that comes from taking control. So remember, you are not just a patient, you are a person with a voice, and your choices matter. The best care is not always the one with the most tests. It's the one that truly respects your health, your time, and your peace. Robert's story, and the stories of many others, remind us of a simple truth. Healthcare should work for you, not the other way around. You should never feel pressured, scared, or confused into saying yes to something you don't understand. You should feel empowered, respected, and heard. So if you take one thing away from today's conversation, let it be this: you are in control of your health. Ask questions, make informed choices, focus on what truly improves your life, not on ticking boxes. I hope this conversation gave you the clarity and confidence you need to take the next steps wisely. And if no one has told you this today, your voice matters and your well-being is worth protecting. Take care of yourself with intention, not fear. Because real health isn't found in endless tests. It's found in living fully every single day.